This has taken over a year of this task force work to get where we are today. This will be the first time a public cord blood bank is to be established in the state of Connecticut. Now, there's only 15 states, roughly, that have a public cord blood bank, and the significance of that will be discussed by doctors a little bit later on. But this will help generations yet unborn and help people who have yet to be diagnosed with cancer. This is an opportunity to treat not only people here in the state of Connecticut, but across this nation. There are over 40 different diseases that can be treated by cord blood. And the research is growing exponentially with the use of cord blood. Simply put, cord blood is extracting cells out of discarded material after birth. And it is these stem cells that are used to create the necessary work to fight diseases, cancers, and other types of diseases. You can't get this far in a piece of legislation like this unless you have an orchestra of people who are helping you. Behind me, you see a lot of the faces, and there are more. But I'd like to thank the chairs and ranking members of Public Health, one, for seeing the foresight of this bill and allowing a task force to go forward that met all summer long. We also have a lot of support by bipartisan legislators on this. We have the doctors from Yale and doctors from UConn who joined the task force, whose expertise was critically needed at this. The private OBGYN group came to the table at our task force to give their input. The National Bone Marrow Donor Program, a guy named Michael Boo, came and gave his advice. We had parents who lost their children to cancer who are also part of this group. Casey Rose Foundation out of North Haven was one who started this process by bringing this to my attention a few years ago. And then you have legislators like Representative Miller, who actually had stem cell research performed or implanted for his cancer. And the Department of Public Health here has been a part of our process and has been really good. It is this orchestra of people that really got this going. I'd also be remiss unless I didn't take this opportunity to thank the conductor of this orchestra, which isn't me. It's Chris Fletcher. My aide really is a guy who got the meetings together, pulled the legislation together, did the minutes and the notes. And he did tremendous hard work. And Chris, I want to thank you so much. Now, I know my limitations as a legislator, so to talk more specifics about the stem cells and the cord blood, first I'd like to introduce someone who I got to know in this process. Initially, we were at different ends of the spectrum, and I was wrong on the issue of cord blood, and he corrected me. But since then, we've become very good friends. And I'd like to introduce Dr. Charles Lockwood, who is head of OBGYN at Yale Hospital. Dr. Lockwood.
Well, first of all, again, thank you, Representative Ritter, and Dr. I keep calling Senator Fasano doctor because I feel like his expertise in this area has grown so much that it's like speaking to a colleague. But actually, in all seriousness, he has been able to pull together an extraordinarily complex issue and come up with a solution, I think, that is incredibly inexpensive for the state and yet will allow us the opportunity to achieve something that's only been achieved by 15 other states with a lot more expenditure. So literally any woman delivering in the state theoretically will now be able to donate her baby's umbilical cord blood, which will be available for stem cell transplants in the future. And currently these specimens are being thrown away. So this is a huge accomplishment, because up to now, the only way for a woman to be able to store her baby's stem cells was through a private bank that would cost somewhere around $1,500 to $2,000 to initially store the blood, and a yearly storage fee of between $150 and $200. So really only the very affluent were able to do this, and more importantly, they would only be available for that child, and the likelihood of the child needing that blood was only about 1 in 20,000 at kind of the best estimates. So now literally any child in the state, and theoretically an adult, would have access to blood collected in the state and stored and banked through the National Marrow Donor Program. And this is, I think, an extraordinary accomplishment. I think the process that was followed was done in a way that was both scientific and in a way that was also very prudent in terms of the state's finances. And I think you really to be given great credit for that.
Thank you. I would also now like to introduce, I got to tell you, these two co-chairs, Dr. Lockwood and Dr. Campbell, did a great job at moving this forward. They obviously know their stuff, but more importantly, they're very good business people as well as very good doctors. So let me introduce Dr. Campbell, who is the interim chair at OBGYN at UConn. Dr. Campbell?
Good morning, everyone. Thank you for coming. As Senator Fasano and Dr. Lockwood have pointed out, this is a tremendous opportunity for not only the state of Connecticut, but also the nation. As the Connecticut Cord Blood Task Force undertook this investigation, we heard testimony from experts in cord blood banking that made it very clear that it's important in any type of program that there be a good mixture of racial and cultural diversity in the specimens that are in the cord blood bank, just like with solid organ transplantation. And this legislation, as Dr. Lockwood pointed out, will allow more citizens, more opportunities to help each other, not only in the state but also across the nation. By having more diversity of stem cells in the cord blood bank, it improves the chances that this technology will be helpful to everybody, children and adults alike.
Thank you, Dr. Campbell. And we talked about the Casey Rose Foundation. That is about a little girl who had cancer. She had some bone marrow transplants that didn't work. Then the parents had found out about the stem cell. There were some stem cell transplants, and that extended the life of this little girl for a period of time, but she did pass. The parents then established the Casey Rose Foundation, and the mother is going to come testify tomorrow, but I just wanted to share this quote. "We implore all of you to embrace this unique humanitarian opportunity to become part of a solution in saving lives in the near future and for generations to come." And it is our hope that after the public hearing, the bill gets out of the committee and the legislature embraces this bill. If there are any questions, we'll stay for questions.